Dear students, I'm Dr. Pratibha. Here we are going to check few muscles of the back for the spot test purpose. Number one, you should know the bony landmarks and the origin of all the muscles. Number one, okay, this is the spine of the scapula. So above the spine, this is called supraspinous fossa, and this is called infraspinous fossa. So supraspinous fossa and infraspinous fossa are here, and this is the lateral margin. This is the lateral margin of the scapula. The upper part gives origin to the teres minor muscle, and the lower part gives origin to the teres major muscle, and the inferior angle of the scapula, the muscle related to the inferior angle is latissimus dorsi. So here teres minor, teres major and latissimus dorsi, all these muscles are important. And this is the spine. Above the upper border of the spine, we have the origin of trapezius and inserting point of trapezius, and the lower border of the spine you have the attachment of deltoid. And the deltoid anterior fibers, they take its three fibers. Anterior fibers, they take its origin from the lateral third of the clavicle, anterior surface of the clavicle, and the lateral border of the acromion process, and the inferior margin of the spinous process. So it has three fibers for deltoid: anterior fibers, middle fibers and posterior fibers. All the three origin the student should know. So I will erase all this stuff, so it's easy for you to remember. Number one, supraspinatus. Number two, infraspinatus. Number three, trapezius along the upper margin. Number four, deltoid, 1, 2, 3 fibers, and this is teres minor and this is teres major, and the inferior angle latissimus dorsi. And if you see, there are two lips here. Okay, this is the intertubercular sulcus, and this is the medial lip, and this is the lateral lip. Okay, medial lip attachment for teres major insertion, and lateral lip attachment, the pectoralis major. So pectoralis major goes to the lateral lip. Teres major, from the back it is coming to the medial lip. So teres major, it takes its origin from here and it is attached to the medial lip. Teres major, so medial lip. Okay, so these are the things you should keep it in mind. And the supraspinatus, infraspinatus and teres minor, this is called greater tubercle, and this is called lesser tubercle. Okay, greater tubercle, muscles getting attached to greater tubercle are supraspinatus, infraspinatus and teres minor. So supraspinatus, infraspinatus and teres minor, all the three are getting inserted into the greater tubercle. Okay, so all the three muscles, they get inserted into the greater tubercle, SIT. And lesser tubercle, you have the muscle gets attached to the lesser tubercle is subscapularis. So this is the subscapula, the costal surface of the scapula. So from here the subscapularis comes and gets its attachment here. So all the three, supraspinatus, infraspinatus, teres minor gets inserted into the greater tubercle, and subscapularis gets inserted into the lesser tubercle. Right, that's all about the origin, insertion of the muscles of the back. Now look at this picture, we can see the muscles. Okay, number one, from there whatever we see, this is the spine of the scapula. So this is spine. So below the spine you have infraspinatus. Supraspinatus is above the spine, I didn't show that. This is infraspinatus, and next to this is teres minor, slender one. This is teres major, and this is latissimus dorsi. So you revise it again, all the 5 muscles. Okay, so these are about the, and this one is deltoid. Okay, this one is deltoid, the bulky muscle. Below the deltoid only you could see all these muscles. Again, this for you to test, and this is the arm, this is the arm area. So you just leave that arm area for orientation. This is the cadaver's head area. This is cadaver's head, and here you could see other muscles. Ready? Number 1. So we can come from here. This is the spinous process of the scapula, and this is infraspinatus, this is teres minor, and this is teres major, and this is latissimus dorsi. Very good. So this is how we should identify